Good morning, everybody, and welcome to the Lance McHan Show. My guest today is Midtown Optometry. I can't even say that. Derron Lee and Leanne Lee. We've known each other for some time, and the other day I went to their Wind Down Wednesdays, and I learned so much about vision, and so I just felt like I had to have them on. So thank you for
Thanks for having us this morning.
in.
Yeah, finally.
So,
I
know. It's been 2 weeks. No. Hey, if it wasn't for your tight schedule.
You know what? We always make time for you, man. Come on now.
Thank you.
Yes.
So, Leanne, what is your specialty? Because I know you focus specifically on one or a few different things.
Right, yeah. So my specialty is in vision and development, and it's really about how vision impacts the way we learn, and how kids may struggle in school, because a lot of times we think that the myth is 20/20. Either you can see clearly without glasses or with glasses, then your vision is perfect. But in reality, it's just, perfect eyesight. But vision is much more than that. Vision is how we interact with the world. Vision is how we function. And so it's really about the kids struggling in school.
Yes, that's the big takeaway I took away the other day. We'll dive back into that because I think it's really, really important for parents to understand that part. And Derron, what is your besides?
You know what? I'm the jack of all trades, so I handle all the primary care side of the practice. Okay. So eyeglasses, contact lenses, ocular disease, eye infections, eye injuries, and everything too. Laser surgery consultations. So we do a lot of
Lasix.
We do eye Lasix. So it's where we co-manage with a couple, ophthalmology groups here in town, off of March and West Lane, and we do the eye LASIK procedure where there's no blade at all for the laser surgery procedure. So it's kind of like the iPhone 11 version of laser surgeries. So me, I'm a tech geek. So.
Yeah, right.
Yeah.
So who would be a good candidate for Lasix?
Well, the minimum age is typically about 22, 23. Okay. And the key thing is that the prescription has to be stable for at least a year. And then our patients who want to consider laser surgery have to be out of their contact lenses for, 2, 3, sometimes 4 weeks. It really depends. But we, of course, would do a baseline comprehensive eye exam first. And then after that, we would schedule a free consultation at the laser center, getting some diagnostic testing done, and that consult's free too. There's no charge for that. And then myself, and the surgical staff over there at the laser center would evaluate the results and green light or not. So it's like a space shuttle launch, pretty much too. So we gotta make sure things are good before we do anything.
So somebody who just needs reading glasses would not be a candidate for LASIK.
No, yeah. Usually that's when that typically hits people when in their late, mid late 40s, and so we would do contact lenses for those individuals actually that have the reading boost in them, or we do computer glasses. And there's another alternative surgical procedure. It's called refractive lens exchange, and so RLE for short. And that is where there is
sounds painful.
Not at all. Actually, you're knocked out. Actually, you're
okay.
completely. It's like a souped up cataract surgery. Okay. And so cataract surgery, the internal lens of the eye is actually replaced with an artificial lens implant, and but that implant is a upgraded version where it has a reading boost in it. So you take care of the cataracts and give the reading boost at the same time, which is pretty cool.
Oh wow!
Yeah, and co-manage for that too. Yeah.
Eye surgery's come out.
Yeah,
technology.
Yeah, it
has come a long way.
Yep, exactly. So,
So let's dive back into children and reading.
Sure. Yeah.
Because I think that's a huge factor. Something I learned on Wind Down Wednesday was that children who may be ADHD or diagnosed ADHD are not or cannot be ADHD. They just may have a vision problem.
Yeah, so really the key thing is that we just want to rule out if there's a vision-related issue first, because in terms of behavior, oftentimes as parents, we think, hey, we think little Johnny's, sit down, pay attention. But for us in terms of vision, it's really about visual attention, because if you can't sustain that visual attention, then they're going to do something that's a lot easier. So they're struggling with reading, or they have any eye tracking issues, any eye coordination problems.
What is eye tracking?
So eye tracking is when when you're reading, the eyes have to point together at the same time at the specific word or sentence that you're reading, and they have to flow smoothly from each word. So your eyes are actually physically jumping from word to word, and those movements are actually developed, they're learned, and they're very precise motor movements that are generated from the brain. And it can be irrelevant of actually seeing clear. It's how the person perceives where the words and the images are, and be able to coordinate their eyes appropriately so that they can read and flow appropriately, and that's fluency.
So you have technology that measures
Yes.
that. How does that work?
Yes, absolutely. So they're very similar to chemistry goggles, chem goggles.
I should have brought them.
You're not even prepared, Derron.
I know, right? I'm sorry.
And they actually have infrared technology on there. So we're going to ask the patient to read a passage that's age appropriate for them.
Okay.
And then we ask them 10 questions at the end in terms of yes or no questions, so that we rule out just the comprehension. Because obviously if the words are too big for them, or they don't know the words, it can slow down their reading fluency.
Okay. So if they didn't understand the words, you would drop them down a level.
Right. There has to be a certain percentage that they have to pass on the test in order for it to be a valid, reliable test. And then from there, we can determine whether or not they're having irregular eye movements or not.
So the way you, Derron, explained it the other day was when they're reading, they're skipping words or they're jumping down sentences, so they're only getting a portion of the information.
Well, you were listening.
I was
Yeah,
impressed.
he actually was.
Because I was like, man, that's because I think. So the thing is, I think you said something about the kids think that everybody sees that way.
Right.
Yeah, and that's the thing too, is that a lot of people say, well, Doc, when should my kids get their eyes examined, right? So the first exam, by the way, for kids is at 6 months old.
Really?
Mm-hmm.
Yes.
Yeah, 6 months old is their first eye exam, by the way, and
How do you exam a 6 month?
Well, we hit the lights in the exam room,
Okay.
right, and then mom or dad would actually hold their baby in the chair, an exam chair. And we use a retinascope and with a lens bar. I should have brought that too. And we would
They can see all that stuff in your office.
Yes, they can. Amongst other things too, which is pretty cool. I invite everybody to come out to the office too. By the way,
It's a great experience.
Right.
Just to take a tour.
Yeah.
You learn so much about what vision and stuff.
Yeah, it's not just better 1 or 2. It's not those. We're IDOC 2.0.
I do want to say though that in terms of having your baby come in at 6 months, we're really checking to make sure that developmentally they're normal, and we're also looking for retinoblastoma, which is cancer of the eyes, and that can be very, very fatal. If you don't have insurance for your baby, we participate in Infancy, which is a free program. So just bring them in at 6 months. We'll assess them. It's free. We just want to make sure that they're getting a good start in life.
Mm-hmm.
Yeah.
And then what's the follow-up from there every year?
Yeah, so typically annually, we want to make sure that they're ready to start school. That's another thing too, that they're developing normally. Just like, when you first have your baby, you have to bring them to the pediatrician. They ask you about all those milestones. Well, vision also has its own milestones, and no one ever tells you about it.
No.
Yeah, are the eyes tracking? Are they crossing midline? Are they reaching over to the left side or the right side? Vision actually controls motor movement of the body, and if it's not developing well, you're going to see, changes in motor movement of the body.
So touching back on that, a kid who is diagnosed ADHD may possibly have a vision problem. They're not paying attention because they're not getting the information. So the assumption is
Correct.
they have an attention problem, not
Sure.
a vision problem.
Right.
So you
Yeah.
shared a story. There was a lady there when I was there, and it was like so
That was
powerful.
I was not expecting that.
I was like
That was
almost the whole room was crying because it was so
yeah.
touching.
Yeah, it was great.
So you want to highlight that story real quick, Derron?
Yeah, you know what? Since actually, I think Leanne knows the story more than me, because she's been working with them.
Well, it's just one of our wonderful patients who she was on the brink of possibly getting diagnosed for ADHD, and part of it was because her eye was actually straying outward. And she's met several surgeons over the last couple of years, had told her that, they need to do surgery on her because the eye was straying. And in their mind,
you say it was like one eye was
it was going
slow?
outward. It was going outward. And it was getting more and more consistent. And she was struggling in school as well, too. But mom felt that, my kid's smart. I think there's another way to get her, what else can we do? And I think she heard of us through one of the workshops or a friend. And she brought her in, and I said, well, this is clearly not a muscle condition. The muscles are healthy. But what it is that the brain just doesn't sense where the eye is. And so we want to do vision therapy to to allow the brain to learn to use the eyes.
Control that muscle.
Absolutely.
Mind-muscle connection.
And when that happened, she just opened up as a person. She was so quiet. And now she just can't stop talking. She's making more friends at school. And she's doing a lot better in school overall. And now she also doesn't really qualify for the ADHD
she's doing
condition
so
as well
well
either.
in school.
She's doing
So
so
how
well
long
in
was she
school.
with you?
She was with us for 9 months. So she did 36 sessions of therapy with us. It was
And the
once a
mom
week.
literally drove like an hour or more,
Right.
hour and a half to the Stockton,
To the workshop.
just to
Share her story.
Yeah.
And I seriously didn't, I was kind of getting choked up too. And that was not rehearsed. That was just off,
Off
she
the
was shooting
cuff.
from the hip, off the
Yeah,
cuff
man,
and everything
it was-
too. And man, it was just, it was crazy.
Yeah.
Yeah, Lisa is a phenomenal mom and everything too. So, but yeah, just those kind of stories where, after we're done with our patient in the Vision Development Center, we actually have a graduation.
Really?
Yeah, graduation after, because they did all the work, right? And what's cool too is that the parents would actually share in a written testimony with a photo of their child.
Oh, that's what that was on the wall.
Yeah.
Exactly.
Okay,
Yeah.
okay,
Yeah.
wow.
So we call it the success stories wall. When when people come into our office, you'll see on the left, you'll see a whole entire wall of success stories, and that's just some of the. Oh gosh, if we have. I swear, if we actually put every single success story testimony
Hundreds.
up, all our walls will be
Thousands.
filled. So we just basically said, well, we don't want to look tacky, so let's have a little section that's more recent and everything too. So
That's pretty cool.
it's pretty fun. It's pretty awesome too, and that's what really drives us to do what we do, is to have those type of outcomes. And like our mission statement for our practice, we always thought about like what's the purpose? What's our purpose to be here in Stockton, right? By the way, Leanne and I grew up here. We're born and raised here in Stockton. So
Then you moved away for college and then
yeah.
came back.
Yeah,
Yep.
UC Davis.
Yeah, I followed her coattails, by the way. We've been together since junior year of high school.
Oh, wow.
Yeah, so she
Yeah.
can't get rid of me. She tried a couple times. But
I tell him he's aged like fine wine. He gets better as he's gotten older.
Speaking about the wine, how was the wine at the workshop, by the way?
It was good.
Yeah,
It was great.
It was fantastic, right?
So you're
Okay,
looking
all
for
right, good.
Derron 2.0?
Yeah. I have a Derron 2.0. His name's Logan.
Yeah.
Drive you crazy too?
Yes.
How old is Logan?
Yes, Logan is 9.
Oh, okay.
Yes.
Yeah, it's crazy though. That I just had a conversation this morning actually about he was I was just talking to him too because he's 9, and I was like, Logan, look, you're halfway through. You're growing up so fast. 9 more years and you're out of the house. So 9 years to be a good
Yeah.
boy, to a good man.
Yeah.
So it's like I pray that he doesn't do the same crap that I do. So.
I know. We all do that. I was talking to a friend of mine. He was telling me the same thing. He's like, man, if my kid did half the things that I would be flipping out.
They'll be in jail.
Right.
Yeah. It was a different time. It was
sure
kind of
is.
a little different back then.
I
than
know,
it is
right?
Now. Things are too hypersensitive and crazy. So.
Yeah. Oh my gosh. But yeah, so it's like that's why I have the wine at the workshop to chill everybody out a little bit.
Yeah.
Just to enjoy.
So tell me about the Wind Down Wednesday.
Yeah. So that came to fruition. There was this photographer actually in Brazil, and he started what's called the 3 Glasses Project. And so what he did was that he invited people to his studio, and he took headshots of his friends that came over, and he took a headshot of them when they first came to the studio, then another headshot after first glass of wine, second glass of wine, third glass of wine,
Okay.
and did a 4 montage and everything too. So I was like, wow, that was a great way to get people to come to our workshop. Wine.
Wine.
And Leanne makes some great great, meat and cheese boards. I hadn't even pronounced it. Was it, how do you say it?
Charcuterie.
Whatever. Yeah, exactly. What she said, okay? It turned out great, grapes and cheese.
I think they've gotten better over time. But.
Yeah, but that's her knack. And but what better way to come on a Wednesday? Everybody loves wine. And Scott Allen, he's a great friend of ours.
Yeah.
He actually works for winery and distribution. So he brings all the wines and pours for us too. And so we have some awesome Napa wines, Sonoma wines, Lodi wines, of course, all over the place.
That's just the icing on the cake.
What's that?
The wine and
Yeah.
the snacks. The information is.
Yes.
You guys are only getting a bit of what you're.
It's mind blowing, wasn't it?
Yeah, I was totally blown away.
Eye-opening. No pun intended.
Exactly.
We had jokes too.
Well, we did get such a good response from that, and then we just thought, okay, we'll do it every month on hopefully the last Wednesday of the month, and we're gonna do it just I think
First and third quarter.
First and third quarter.
Yeah, first and third quarter because second quarter summer. People cut out for summer vacation, and fourth quarter it's the holidays and everything too.
It's always hard running into the last Wednesday.
Yeah. So we're gonna change it up a bit. We got some suggestions to do it on the
third Wednesday.
Right.
Third
Wednesday of the month. So we'll ramp it back up in January 2020.
Okay.
So
You can't interfere with the Stockton business mixer though.
Oh yes, of course. Of course. Yes. Maybe the second Wednesday. We'll coordinate, man.
We'll
coordinate.
Yes.
But yeah, it's been great though. And those workshops are free too, and it's open to anybody and everybody that has a pair of eyeballs and a pair of ears and an open mind. So and we have a max capacity of about 30 people. Otherwise, Leanne will be making a lot of, I don't know, how do you say that word again?
Charcuterie.
Yeah, exactly. What she said again.
So
Now spell it though. Can you spell it? Can you spell that?
Sure,
Can you spell it?
sure.
I can't spell it.
S-H.
S no, it's C.
Oh, shows you how much I know.
Meat and cheese platter.
Meat cheese platter. Some raviolis. You also do sports, something like to do with sports.
Yeah, so that's pretty cool. I've always wanted to do something, always different, right? And so my buddy Joe Bingold, him and his friend Herb Yu, they actually work with Nike at the Spark program up in Oregon.
Oh wow!
Yeah, so the Nike Spark program, and so what they've done have a whole accumulation of data from pro athletes, college athletes, high school athletes, different sports, different genres, and we're able to assess and evaluate athletes on their sports vision performance, and we're able to evaluate that particular player, and then playing sports in high school. You play? No.
Race cars.
Race car. You know what? But there's actually something with that too. But any sport, any sport at all. But what's really neat is that we would evaluate the players on 10 critical visual skills, and their data will be compared to other players on their same exact position, on their same exact level, and be able to compare themselves in terms of where they measure up. And it's right on the fly too, which is really cool because athletes, they want to have like instantaneous feedback like boom right now. And so once we identify what opportunities we have to improve on a visual skills standpoint, then we get to work. You
create like a prescription or training program.
Right? Exactly. So because again, what Leanne was talking about, the eyes lead the body. So especially at baseball, for example, you have so much time, a split second, to go ahead and
the 90-mile-an-hour fastball.
What the heck happened to the Astros last night, by the way? What was going on with that? They just got killed. Go Kings, by the way. So different sport, of course.
What about shooting, like competitive shooting?
Yeah. So matter of fact, we just had competitive shooters actually come through and do their evaluations too.
Oh, that's pretty cool.
Yeah. So I don't know if you Christine Zador, Linden Gun Range. Yeah, she came out. She got evaluated and everything too, and she was on fire. Dude, she's a beast.
Well, she probably's got 10,000 rounds of practice.
Yeah, you live out there, right? So, but yeah, we have all sorts of athletes come in. Just recently, we had the Great Bets softball. A lot of softball players come through. Basketball. Hockey. On the Stockton.
The Kings.
The Kings. Yep. On the Stockton Heat hockey. Eye doc. So hopefully they don't have to come to me for concussions or anything. Yeah. So that. what's crazy too is a lot of people at the workshop didn't know is that 80% of the brain is actually wired for vision. So if there's a concussion event, then there's actually a
short circuit in the vision, possibly.
Yeah, absolutely.
Yeah.
Yep.
So once we identify them, initially for these athletes, right, and God forbid there's a concussion event, they get concussed, then we go ahead and evaluate them again after their concussion, and then be able to rehabilitate them back to their normal, because we actually specify where their
the vision impairment
Yep.
is in the brain.
Yep. Yeah.
Wow.
Yeah.
I
So it's
had
not
no
just
idea.
yeah.
It's not just like 1, 2, get some glasses, you're on your way.
Right.
Yeah, well, that's the misnomer. That's
Or
the
hit-
misconception.
Or hit up the liquor store or the pharmacy for some readers.
Yeah.
It's high
But-
tech.
Yep, it is. So that's what's really neat about what we do is that the experience, as you were talking about, that's our goal, to be, totally different, than any other optometry practice in the whole entire, Central Valley, which we are.
I was gonna say, I think you hit that mark.
Yeah,
Yeah.
yeah,
Just walking through and taking a tour
yeah.
of your facility, it's
We have fun too.
Yeah.
Well,
I also think that I think the first thing we did when we speak to our staff is we always ask them, what business are we in? And they always say,
customer service.
no, they say eye care, And I said, well, optometry is our profession, but our business, we're in the business of taking care of people.
Right.
And they just happen to have eyeballs. And as a doctor in general, when you're treating someone, you're treating someone. You're not treating their disease process. You're not treating, a label of some kind. You're treating that person. And in order to really treat them, you have to understand who they
I
are.
like that. That's kind of my business.
You got to know the
model.
person.
Take care of people.
Absolutely.
the more people you take care of, it just our business grows.
Right.
You know.
My feeling is if you give more in value than you receive in payment,
Right.
you'll never go hungry.
Yeah, exactly. And that's what we do too. We do a ton for the community.
Yeah, let's touch on that.
So being born and raised here in Stockton, right, is wild that I never thought we would come back home. I never thought at first.
When you left, you're like, oh, see you, Stockton.
Yeah, no, seriously, that was
I
my.
love the Mexican food, but I'm not coming back.
Well, that's what kind of brought me back, actually, tortillas and stuff like that too. No, I'm just joking. But yeah, after we left, went to UC Davis for undergrad, both of us, and then we went to New York for optometry school. We were planning to be staying in New York, right? But then 9/11 hit, and gosh, we were there during 9/11.
Wow, I can't even imagine that.
And at the time, we were living in Brooklyn, and our train would go right underneath the Trade Center. And we left early the day. I never leave early.
It's very rare.
It's very rare that we leave early, but our train goes right underneath the Trade Center. So if we left our normal time, we'd have been stuck in that mess. But we popped out of Times Square, and everyone knows what happened. But that right there, just like, man, I got to come back home. This is too crazy, And plus, I'm a mama's boy too. I love my mom to death, but man, she drives me crazy though.
Don't they?
So yeah, that's a different podcast, by the way. But it's really cool that where we came back home, set up shop, and there's just so many people to help here in Stockton. A lot, and it's just I just want to do my part. So what we've done is that for the past 15 years or so, we've been doing pro bono eye exams and glasses for the farm workers, Western Farm Workers Association. We've been doing that ever since we started. Every month, we'd see patients, for that organization. But more recently is we have our Gift of Sight program, and so we partner up with St. Mary's Dining Room.
Okay.
So Ed Figueroa, I got introduced to him back in 2009 through the Leadership Stockton program. And
So is this the program where people donate their old frames and then you?
Nope.
No.
No.
Okay.
So essentially, the eye clinic over there. Have you been to St. Mary's Dining Room?
It's been a long
Yeah.
time.
Oh, we gotta go. We'll put on the hairnet and do the whole. They feed about 900 people every day. By the way, breakfast, lunch, and dinner.
Wow.
And it's all volunteer based and stuff like that too.
Let's do it.
Yeah, it's crazy, man. It'd be pretty fun too. But anyways, they have a health clinic there, a pharmacy, dental clinic, eye clinic there, and the eye clinic. All the glasses that are in the eye clinic are from us, and the brand spanking new frames too. And matter of fact, I'm wearing the frame 1-for-1. And what's really neat though is that for every patient that we see in the office, there's a brand new 1-for-1 frame that goes to the eye clinic.
Oh wow! So they get to pick which one they want.
Yeah. So every month we actually do that, and so our goal is to get 300 patients every single month at the office. So our goal is to get 300 pairs of.
So how much is a pair of these? What's a pair run?
Those ones right there are typically like 140.
Okay.
You know, $140. You know, for the frame.
How do I look?
Green looks
Yeah,
good on
It
you.
looks good on you, man. Brings
Yeah.
the color out of your eyes, actually, too. You know. But what's really cool though is that the 1-for-1, they're really community oriented too.
Yes.
So we always partner up with companies that have a whole, community outreach, and we integrated it, which is kind of cool. Where on the temple, you could actually see it, maybe not. 'Cause,
Their motto.
Their motto is "You buy, we give."
So what if somebody just wanted to, like, buy a pair and give 2 pairs instead of 1? So
We could do that.
if let's say I want to give a pair of glasses, I'll buy this one and end up giving 2.
Yeah.
Sure.
Yeah, sure. That's not
Absolutely.
Buddy.
Yeah, that's not bad at all, too. And so, we want to make sure that people get taken care of themselves, too, because our goal is also to build up, and we're always accepting new patients, too. So, and we have an opportunity to grow, because my ultimate goal is to have a 4th-year residents from optometry schools in the nation come here to Stockton, get trained by us, and, hopefully develop a continual type of relationship and bring new talent to the Central Valley. Because that's a problem. Everyone wants to come to California, docs and everything, right? But the problem is that no one wants to come to Central Valley, especially Stockton. They want to be in the Bay, LA, San
You need
Diego.
to fix that.
Well, that's my goal too, is to bring new talent here because, gosh, we've been doing this for, since 2003.
Okay.
And there hasn't been a new doc put their name on a building or anything like that too. So we want to bring some. I don't want to be the only one.
Well, sometimes you gotta lead by example.
We gotta try, man. We gotta try. But that's what's really cool though. So when patients come in, our goal is to get 300 patients a month. We're about 200 right now, 220. So a lot of opportunity to grow. And then with that said, when we get that patient count, we always post on Facebook is hey, we're at 150, we're at 200, we're at yada yada, and then we go over to St. Mary's dining room, drop it off personally to the eye clinic with Ed, for Figueroa and stuff too.
Wow,
Yeah.
that's pretty cool.
Gift of sight, man. That's what we do.
I love it.
Yeah.
So how do people find you? What's the best way to find you?
Facebook.
Facebook?
No.
Where are you located?
We're located at 2321 West March Lane, which is right across the street from the Quail Lakes In Shape.
Okay.
MidtownOptometry.com.
If you drive by March Lane, you probably
Yes.
seen their
Well,
big-
if you can't see the sign, you definitely need your eyes checked.
You need your eyes checked for sure.
And it's also lit at night.
It's
So
lit at night.
again,
It's like the bat signal, It's like boom, But yeah, we're right there, and we have a great social media presence on Instagram and Facebook.
So what's your tag on Instagram?
Midtown Optometry.
Midtown? Facebook, Midtown.
Midtown Optometry. Yelp, Midtown Optometry too, So we're all over the place. But yeah, we just want to thank you so much, Lance, for
Thank you
having
for
us
making the time
on this too.
I mean, without people like you wanting to come here and tell their story, I wouldn't be able to do this.
Yeah, right.
yeah, thank you.
And a lot of people say, what do I talk about? I'm like, whatever you want to talk about. This is your show. I
Right.
just happen to be the host asking you questions. So it's all about you.
I appreciate you, man.
So
Thank you so much.
guys
Thank you.
for
Thank you so
stopping by.
much.
Thank you,
Yes.
Thank you, Derek.
We'll get some more. We'll get some more drinks and stuff like that.
Yeah,
Get some more wine
get
or
some
something.
golf going here.
Yes.
Yeah, I need some help, seriously, too. I'm like the Asian Charles Barkley, My swing's so butt ugly. It's so bad. I'm trying
gotten better.
though,
He's
man.
gotten
It's
better.
gotten better.
Thank you, guys, for tuning in, and stick around for the next episode. Have a great day, everyone.
Thanks, guys.
Can't you